physicians in some basic screening things, because if you ask the right questions and if you kind of interact with the child in the right way, you can see some of those things.
And what are some of the ways that you can do that?
Well, one of the tools, and it's not perfect. There's a screening tool called the CHAT. And that tool actually takes a child through some interactions with the pediatrician, where the pediatrician will try and gain the child's attention, will point to something of interest to see if the child will follow, his or her lead. And that tool has been shown to have some effectiveness. Now, with our project, children who are referred to us, we actually do a complete diagnostic battery, which includes the ADOS, which is the best tool now, an autism diagnostic observation schedule. And we also do measures of cognitive functioning, and we include a team including a speech therapist and an occupational therapist. Because individuals with autism, this is somewhat controversial, but individuals with autism often have strange sensory perceptions. They may not be able to tolerate noise or touch, or they may crave sensory stimuli. So occupational therapists are often involved in assessing that and trying to come up with exercises and things that help the child deal with that.
Now, diagnosis is one of the big things. You've talked about diagnosis and training, but if someone would notice, and I guess, are there other signs? We talked about that, but if someone notices a sign, do they usually take it to their doctor, and then the doctor will, there's early intervention. Do we need referrals from doctors? You said the parent's the best expert.
Usually, I think the first contact for most parents usually is their doctor. And what can happen from there is that the doctor might refer the parent to early intervention. Now, parents can self-refer to early intervention as well, and but often doctors do refer. And it's very important. Sometimes doctors, and I know, Pat, when you said you have 6 children, I have 1, and I was kind of a nervous Nellie as a mother. And I think sometimes my pediatrician just thought she's overly anxious. And so, if my daughter had had these symptoms, he might have said, calm down, wait and see. But it's important for doctors to really listen to moms and make that referral. Early intervention is supported by the state and by the federal government, and so everyone can have access to it, and it's based on your ability to pay. And they will do an evaluation through early intervention for a child who presents with any kind of developmental delay.
And the reason for that is the earlier the better.
Absolutely.
Because so many of these things, including autism, you don't have to suffer the lack of communication skills if you start training early.
That's true. We're amazed at the kids if they get the appropriate treatment, the things the kids can do. And what we communicate to parents is, we can't predict. When your child's 2 and 3 years old, we really can't predict where they're going to be. So your child might still have symptoms, that exist even with treatment, as they mature. But the reality is treatment will reduce any symptoms that they may have, and it will help them be more independent and function better as they grow.
So let's talk a little bit about what are some of the people that, and again, it's important to realize that if you are, as a parent, the expert on your child, uneasy about something, go ahead and go to early intervention on your own. Go ahead and call the Autism Project to get diagnosed. Why do people call? What are some of the things they're saying that could be, help us learn a little bit more about what to look for?
I think one of the things I hear the most from parents when they call is that I'm just really worried about my child. And usually they may call around 2 or 3 years, and they say, I'm not sure what is wrong, but he's not responding normally. They will report things like, I can't get him to transition from one activity to another. He gets locked on a certain activity, and if I try and move him to something else, he tantrums, he becomes out of control, he cries or screams repeatedly. They often say he doesn't seem interested in things other children are interested in. He plays with toys differently. My first boy would roll a truck, and make the truck noise, vroom, and he would use imagination in his play. But this little boy just gets stuck on spinning the wheels, because kids with autism have deficits in what we call imaginative play. They don't make up stories to go along with their play. Those are a lot of the things we hear from parents. We hear non-compliance sometimes, that, boy, this child will not do what I've asked them to do. And oftentimes children with autism don't know what we're asking.
I got a call yesterday, a mother of a 3-year-old who said she just can't discipline, that she can't make her child behave, and that there's just, tantrums are involved and nothing they can do. They've tried everything that seems to be normal, reading the books, trying that, and it doesn't work. And I suggested they call you. And I don't know what's wrong. The mom doesn't know what's wrong, but it's totally disrupting their family life. And so I think sometimes just getting to the point of, if your family isn't functioning because a misbehavior of a 2 or 3-year-old, you are a resource.
Yes, that's absolutely true. And, part of our task would be to differentiate between, is it a behavior disorder or is it something like autism? And I think when you talk about just general family functioning, because the other thing parents report is things like, I feel like I can't really take this child anywhere.
That's what her concern is. I can't go anywhere.
Yeah, that the grocery store really becomes a battleground, So individuals with autism, because they have problems with communication, we actually know they have problems with expressive and receptive language skills. And because they tend to get stuck on certain activities or behaviors, and they have lots of trouble with transition from one place to another, one activity to another, you can see how that would provoke tantruming. Also, they tend to become overstimulated because of the sensory environment. So when you take these little folks out in public sometimes, you really get it difficult because they get overloaded.
So there's real reasons for that, and these tests that you're talking about, you diagnose on certain days, or what is?
We actually, at this point, we are working the diagnostic portion of the program as a training venue. So we actually invite people from the school district, school psychologists, and early intervention workers in to work with us, because we want people to learn about autism. But we do those mainly on Tuesdays and Thursdays. And then we actually bring the parent back, have discussions. We work with the early intervention or early childhood workers to talk about what is needed in those programs. Our project is actually really defined as systems development. So we do some direct service.
And you did say systemic, and then you used another word too that made me think, a spectrum.
Yes.
That you go, so that it's not just one thing, and the spectrum means that it gets worse or that it's just different.
The spectrum word has two things. One, that there's lots of kinds of autism. And then even within that type of autism, even within one diagnostic category of autism, there's such great variability. So it's really a challenge to clinicians, because you have to really get to know that individual person and assess their individual strengths, weaknesses, and design a treatment plan that will fit them.
And so I think we're in an age of, if something's wrong and someone would suggest that my child has autism, I go to the computer, I read everything. It's more difficult than that. There are really not that many people, even in the state of Illinois, that diagnose autism, as from what I understand. It's not something that computer mom can do, and that we really, because these are our babies and our future, and the earlier that we can get help for them, err on the safe side.
Absolutely. If you're worried about your child, talk to your pediatrician, call early intervention, get some help. That's the important thing for parents to hear.
And I've been at early intervention meetings when the moms come back and say, she's normal. That's the overwhelming message I'm getting after early intervention has gotten speech therapy, whatever it is. That she comes back, she says, look at her, she's doing everything. She couldn't sit when I brought her in. And look at what she's doing now. So we have today, our medicine helps us correct problems and, get back to normal, but mom has to not be scared and not think there's something wrong there, but to take the advantage of the